Welcome, learners. Today we're going to study laboratory standards. So let's talk a little bit about what makes the lab standards what they are. So the Clinical Laboratory Improvement Amendment was passed in 1988, and it sets standards for laboratory testing. This is also, when you hear people refer to CLIA, they're referring to the amendment that was passed that set standards for laboratory testing. And most testing in provider offices is overseen by CLIA and the government agency that supports the standard. Most provider offices perform wave testing, and per CLIA guidelines, wave testing must be performed exactly as the manufacturer states. So that's what the rules are. For the wave testing, each test comes with a manufacturer manual, a user guide, or a package insert that must be referenced when performing testing. For quality control of the wave test, the manufacturer requires external control. Some do and some do not, but if they do, external quality control is required, then 2 levels of quality control must be used. So let's talk a little bit about what may be that 2 levels of quality control. So qualitative testing or quality control is a positive or a negative result. So an HCG or a pregnancy test is going to be a qualitative test. An HCG total would be a quantitative test and would be run in a laboratory where they would give you a numerical value of the HCG. But the routine pregnancy test that is performed at most doctors' offices is qualitative. Quantitative refers to testing that performs a number. So it'll give you a numerical value, and typically the QC is like level 1 and 2, or a low and a high. Some examples of laboratory tests, we're going to review a few. So ACEVA strep testing, this type of test has a dipstick in their testing component, and I'll show you in a minute the picture of the different testing components there. So this is what a package insert may look like. So this is an unfolded copy of what would be included in that box. And so it'll tell you a summary of the testing, the principle of the test. Here it's going to list the limitations, expected values, and then specificity, sensitivity, those performance characteristics would all be included on the package insert. It's also going to include directions for use, how to prepare the specimen, and then the quality control. So here you'll see on the far right-hand side under quality control, internal quality control and external quality control. So that internal quality control, as we discussed in a previous lesson, is included in each test. So a red line appearing in the control region is your internal positive control, and it confirms that there's a sufficient enough specimen for the procedure technique. And then a clear background is in the internal negative quality control, and that's indicating that the test is working properly, that there's no streaking or anything that's interfering with the test results. So external quality control, and as it's listed here, they must be performed in accordance to state, local, and federal regulations. It's also recommended that a positive and negative external control be run once per kit as deemed necessary by your internal laboratory procedures. So a laboratory could create their own procedure that may exceed manufacturer's procedures and requirements, but they can't do any less than the manufacturer requires. So in this particular test, you're going to have a positive and a negative QC swab within the box, and it's going to be run each time a box is opened. So here's an example of an HCG test. It's a picture of the box of tests, and then on the left-hand side is a picture of the actual cartridge. So you'll see a sample well at the bottom. That's where the sample of urine or quality control is going to be placed. And then you're also going to see the test region and the control region there. This one has not been run yet. So here's a package insert. Again, it's got the summary and the explanation, some principle of the test, storage requirements, and how to prepare the sample and to perform the test. So you'll see there in the middle, the graphic there, it indicates 3 drops of urine or serum. And then there's your positive, negative, and invalid examples of results there. So here we're also going to review what it says about quality control. So there, an internal quality control, we talked about that a little bit with the strep test. It's very similar here. The control line should appear, and it should be, it should have a color, and it's indicated that the sample is appropriate, and the internal negative procedural control, the background appears in the result window, and there's no interfering streaks or lines or anything that would cause difficulty or interfere with the ability to read the test result. So that has to happen if it is a patient result or a QC result. And here it says external controls may also be used to assure that the test device is working properly. It's recommended a control be tested before a new lot or new shipment as good laboratory testing practice, and users follow federal, state, and local guidelines. So as long as your state or local guidelines do not exceed this manufacturer requirement, QC must be run each time you have a new lot or a new shipment of testing. This is also just, it's different in that the quality control, external quality control is not included in this box of HCG test. So typically you would purchase an additional external QC that would be appropriate for this testing. So here, what do we want to learn from those package inserts? We want to learn what QC is required. Is it internal only, or is there an external QC requirement? What is the frequency of the required QC? So we found out with the strep that the required QC was each box. I can't remember exactly the verbiage that I used there, but and then the frequency of the HCG QC was each lot and shipment. And then how do we know it's acceptable? So we want to make sure that our positive QC is indicating a positive result. If we run a negative QC and we yield a positive result, then it's invalid. It's not what we expected. So that would need to be repeated. And I'm not sure, you know, there could be other factors. Someone could have picked up the wrong one inadvertently. It could be contaminated in some way. So those things are very important to think about when you're running quality control. Urinalysis. So this test is not going to be as straightforward because it's multiple analytes, and it's also a semi-quantitative test. So while you do have positive and negative on some of the analytes here on the urinalysis, some of them also yield a numerical value. So the strips that we would recommend would be on the one side, those multi-stick strips are going to be for urinalysis, and then the quality control would be Quantimetrics. It's an external quality control. So within that bottle of strips, in the box that the bottle comes in, there's also a package insert that, like we talked about before, is going to give you, you know, how to use the strips and when to read them and what the timing should be. It's also going to include a variety of different acceptable ranges for different things. So the one we're looking at now, you'll see it says visual testing. So if you're running without an analyzer, those multi-stick strips, you're going to use your timer and you're going to follow the procedure on that insert. And these are the expected results that you should get. So whenever you're running, and you do run QC, and you have your timer and you have your results, it's each analyte on the urinalysis strip within the acceptable range. That's important because if all of them on here, all these analytes, glucose, bilirubin, ketones, if all of them except pH are within acceptable limits, the pH is, if the pH reads 6.5, then it's going to be out of the acceptable limits. So we're going to repeat that test, even if all the rest of them are within the acceptable limits. You want to make sure every single one is. Only run patients if quality control is acceptable. So here we're just going to see what you've learned. Make sure to copy and paste this link into your browser and complete the competency assessment. Thanks again for your time.